Morrison.
Thank you, Mr. Chair. Mr. Secretary, welcome. I want to begin by thanking you both for your military service, for your service in this role as Secretary, and for being here to testify today. Before I begin, I just want to preface my questions by sharing with you that my husband is an Army combat veteran, and I care deeply about our nation's veterans, as I know you do. And while we belong to different political parties, I want you to know that I genuinely want you to succeed in this role, because that is what is in our veterans' best interest. Now, I know you had the opportunity to visit the Minneapolis VA earlier this week. I hope you enjoyed your time there. We are incredibly proud of our VA, which, as you know, is a CMS-rated 5-star hospital, one of only 2 such hospitals in the greater Twin Cities metro area. I believe the Minneapolis VA can be a model for the whole system. But I have to be honest with you, Mr. Secretary, the conversations I've had with veterans in my district and caregivers at our VA have me concerned about its direction under this administration's leadership. I know there's been a lot of talk today about RIF efforts at VA, and I apologize if this feels redundant, but I just think it's so important. And I know you don't want to talk specifics, but consistent with your testimony, can you commit to us that any reduction in force at VA will not threaten veterans' care and benefits?
Yes, that has been my goal all of the long. And can I also say this? Minneapolis is great and is a really an example. And for just, and I don't mean to say this, but one of the reasons we have it is we have some longevity of leadership there. That is something that is, I'm looking across our hospitals and others, and we have up and down leadership. Leadership's so important there, and I appreciate what is happening. And leadership, after we had our conversation, was very frank, and they said before hearing we were concerned, and now hearing it straight from me and hearing what we're trying to do, I think it gave them a renewed sense of purpose. I'm really glad to hear that. So, and I know this has been asked, but I have to repeat it. Can you commit that no doctors or nurses will be fired as any part of the RIF? We're not going to fire any. We're not going to be riffing anybody that's actually taking care of employees, or not employees, but anybody that's taking care of our veterans in direct care. Okay. And patient support employees, sir, can you commit to us that no housekeepers or environmental health technicians? No, they're all part of the, in fact, they're already exempt. They're part of the control and laundry workers? They're part of the 300 per thousand that we've already exempted. I am very relieved to hear that. You know, my point really is that, you know, I'm a physician, and after more than 20 years of practicing medicine, I can tell you that it is very much a team sport. The whole team plays a role in patient care. The physicians and nurses, of course, but the support staff is incredibly important as well. These people are mission critical to the delivery of care, and firing them would affect veteran care. These are people who help ensure their operating rooms are sterile, the patient's bed sheets are clean, the medicine and equipment are delivered in a timely fashion. And you've mentioned that you want clinicians returning to the bedside to provide care. Obviously, if we fire the support staff, then the clinicians are going to have to fill in those roles. So I'm relieved to hear that they will not be impacted. And I think we will want to hold you to that, because that I am concerned that there's a crisis of morale right now at VA. I was actually really shocked when I spoke with some frontline VA workers at our Minneapolis VA just the other day. And I was pretty shocked when they said, 2 of them said, I question whether the secretary actually cares about veterans. I was really devastated to hear that, Mr. Secretary, and I would assume that you would be too, because despite our political differences, I genuinely believe that every person in this room cares about serving our veterans, including and especially you. You know what it means to put on the uniform and serve our country, Mr. Secretary, and I have immense respect for that. But I have to say it's troubling to me that VA providers caring for my constituents feel this way. These are your employees, Mr. Secretary. These are the people we trust to care for our veterans, and they're scared right now. If we continue to go down this road of firings and what they feel like is intimidation, we're going to lose good people, and it's going to be veterans that pay the price. And I know neither one of us wants that. So my question for you is, what are you going to do to improve morale at VA? Well, first and foremost, being here, being in every interview that I have. I've spent 100 days in which we have been, instead of working many times on issues that we have found, looking at how we can improve and do this, I have been fighting rumor and innuendo. And this is the problem that I have from day one. There are reasons that people are scared, and it's not coming from my office. It's coming from folks who actually talk about the things that I've talked about earlier. when we have reports saying you're going to fire 15% of the doctors at Minneapolis. That's just a lie.
Well, but Mr. Secretary, respectfully, that 15%, 83,000 number came from your people.
It did come from my people, but it has no context to actually firing frontline employees, of which I have talked about. Because here's the deal. I've said it many times. I repeat it every time that healthcare providers who provide that frontline care, even the ones that you mentioned earlier, are not included in this. But yet every time I turn around, there's another article or there's someone in the community or a member of Congress or otherwise they're saying these radical cuts, these radical things. I'm having to sit here and fight about this the whole time when I've actually said it. So my question is, why is the voices of those who say this is going to hurt being processed and amplified when the very one from the Secretary of VA who is sitting right before you is saying this is the part in process that we're going through?
Mr. Secretary, we would welcome you to this committee anytime. Please brief us. Give us some transparency so that we can reassure VA employees. I do want to ask one other question. The VA Center for Women Veterans sent out an email blast just last night that said it was embarking on an ambitious goal to enroll 1 million new women veterans in VA. I think that's commendable. We've discussed today that women veterans are the largest growing group of veterans, and I, of course, support the effort to bring more women veterans into VA. Could you share a little bit more about your strategy for doing so? And surely a significant increase in demand will require more clinical staff and space, won't it? What is VA's plan for reaching this milestone that you've set?
One, I think the milestone is great. I'm glad you recognize it. We're looking at that and encouraging. But again, this is hard to overcome at this point. I mean, because without going through the process here of where we're actually looking at cuts and putting people back in places where they need to be, in which we could actually increase capacity at some of our clinics and some of our hospitals, which will not affect and actually would welcome these going forward. I think that's the fundamental issue that we're dealing with here, is there's an understanding of what we're trying to do and how that's actually playing out.
Mr. Secretary, I hope you will come back to our committee and testify about all of these issues. We'd love to know what your process is, and thank you so much for being here. Mr. Chair, I yield back.